Hello, Mr. Eric. Welcome to a short presentation about oral health. For your routine oral care, you brush your teeth 3 times a day with Sensodyne toothpaste, with fluoride, and Oral-B electric toothbrush. And also you floss your teeth 1 time a day and don't use mouthwash. Based on frequencies of brushing and flossing, you are maintaining a good oral habit. This is oral learning ladder. It's kind of giving the idea of where patient at in oral learning ladder. So based on your assessment data, you are currently at involvement stage, which means you are interested in oral hygiene care, and also you lean toward to the action in order to improve the oral health. This slide is an overview of plaque and its role in disease process. So plaque is a slimy layer of oral bacteria that lodges on the teeth, gum, tongue, dental implant, dental filling. So once the plaque is accumulated, you might feel fuzzy with the tongue. So it's the top side that you have plaque. Plaque forms when the bacteria in the mouth mix with the sugar and starch from foods. If you don't brush the teeth soon after eating or drinking, the combination of bacteria, acids, and carbohydrates can mix with a sticky colorless film called plaque, and it tends to thicken over time, eventually becomes visible as a pale yellowish shadow on the teeth. I know that you have one implant on the back tooth of lower right quadrant, so it's really important to clean the implant and promote the health tissues around the implant. If maintained correctly with proper daily oral hygiene and regular checkup visit, your implants last a lifetime. So infection is the enemy of dental implant, which means if you don't brush your new teeth and remove the plaque daily, you can get the infection called peri-implantitis, which eventually results in loss of your lovely new teeth. There are several consequences of poor oral hygiene, meaning the plaque is poorly controlled. It can cause the yellow teeth and bad breath. The plaque can also destroy the tooth enamel and cause caries or gum disease. Plaque can also develop under the gums on the tooth root and break down the bone that support the teeth. Untreated plaque can also harden into the tartar. A little bit in detail about some oral problems, starting with the tooth decays. Tooth decays, also known as the cavities. Cavities are defined as permanently damaged areas in the hard surface of the teeth that develop small opening and holes. It can caused by bacteria in the mouth, frequent snacking, shipping sugar drinks, or poor oral care. If the cavity aren't treated, then they get larger and eventually lead to severe toothache, infections, and tooth loss. The next one is the gum disease. So gum disease, defined as an inflammatory disease, affects the hard and soft structure that support the teeth. So some signs and symptoms of gum disease, such as bleeding, redness, inflamed or swollen gums. Gum disease are a leading cause of tooth loss. So tooth loss affects the ability to chew food, and it can get worse with the number and type of missing teeth, affecting a person's diet quality. Gingivitis and periodontitis are two subcategories of gum disease. Gingivitis or inflammation of the gum. It is the lowest stage of gum disease where the edges of the gingiva are inflamed and swollen, but everything underneath the gums, including the bone, are still intact. Gingivitis is reversible, so you are currently at gingivitis with reduced periodontium. So what it means is that you have some signs of gum inflammation, bleeding while doing instrumentation, and also recession, which means your gum is receding away from the incisor edge and start losing the attachment between gum and tooth. So it's really important to start and also maintain a good oral hygiene habit in order to stop progressions of gum disease. For periodontitis, is the severe stage of gum disease actually destroy the tissue. Periodontitis is no longer reversible since the tissue start pulling away from the tooth, which causes the bone underneath to start shrinking.
I'm assuming you already know why it is important to floss your teeth since you clicked on this video how to properly floss your teeth. But if you are interested in learning more about the benefits of flossing, I'll link my video that extensively goes into why you should floss in the bottom bar below. But for the purpose of this video, let's get into how to floss your teeth. First, make sure that your floss is wrapped around your middle fingers with your thumb and index fingers holding the floss, acting as your guides. Now you can bring the tightened floss in between your teeth by pressing and wrapping around a tooth. Make sure you are not popping straight down into your papilla. You do not want to do that. That can hurt your gums. What you want to do instead is wrap around the tooth, hugging the side surface of the tooth to the left and then to the tooth to the right, scraping the sides of the teeth up and down, which is called the cleaning motion. You do not want to use the sawing motion to clean. This will hurt your gums. The sawing motion is only sometimes used when you're entering between the teeth. The sawing motion is always followed by the cleaning motion. Be sure to hug the tooth and go up and down on each side, making sure to go, yes, below the gum line, to the right, and then to the left of the little triangle area of the gums called the papilla. The dental floss should actually disappear in the space between the gums and the tooth surface. These are the sides of the triangle. So that's how to properly floss.
So hopefully you have the idea of oral health and why the oral hygiene habit is really important in order to maintain a good oral health. So please pay attention to cleaning the area around the implants to prevent the destruction of tissue around the implant. Regular brushings like twice a day and flossing at least once a day with fluoride toothpaste to disrupt the formations of plaque. Third, prevents the inflammation gum. See a dentist regularly to maintain oral health.